Karan, tell us about this case.
This was a 45-year-old gentleman presented to us in the OPD with a case of ulcer over the left buccal.
It was a case of carcinoma of the left buccal mucosa, no? Straight away biopsy proven.
Biopsy proven left.
And was put on neoadjuvant chemotherapy on account of the disease being extensive. You can see the when the floor of the mouth partly involved, not completely. And extending onto the gingivobuccal sulcus. It's an extensive disease, although there was no trismus. Right? And you can actually hope that you can resect it now. Patient is how many cycles of chemo?
4
So
cycles.
4 cycles.
What?
Cisplatin
Cisplatin-based chemotherapy. And we are looking at taking up the patient for surgery. Would my margin change?
No,
Sir.
sir.
We'll use a pre.
Like it is gone. It was T4B, but it responded. The trismus has reduced. There's a partial response, and now we're planning to take up the patient for 1 minute. आपको बस जरा देख रहे हैं, दर्द होगा तो मुझे बता दीजिएगा, ठीक है? And these teeth are all tobacco stained. The disease is extensive still. You need to have one CT to see the extent. Upper gingivobuccal sulcus is free, but it will amount to extensive resection, including hemimandibulectomy and excision of the floor. Right?
Yes, sir.
What else? And we also need to do the
Next.
neck dissection. मुंह बंद कर लीजिए, मुंह बंद करिए. So
We should take him for surgery. We'll get a CT done to look for the resectability and extent of the response to the chemotherapy. And if it is resectable on CT, then
what would you normally use for assessing the response in patients with head and neck cancer?
So we can use PET scan. We can use to
PET scan is not a very good idea.
CT.
Basically,
Yes,
what
yes,
imaging
yes.
was used beforehand should be used later on. A lot of people prefer to use MRI to see the extent of response. Soft tissue response is better assessed that way. But yes, you cannot argue for or against. What you used before you started neoadjuvant is the one that you should use afterwards. And we are going to use the RACIST criteria only. What is RACIST?
Response evaluation criteria and solid tumor.
So, partial, complete.
Partial response, stable disease and progressive disease. Partial response is more than 30% reduction in size. Stable disease is less than 30% increase in size, reduction in size, and progressive disease is more than 20% increase in size after the neoadjuvant.
So basically, it's an arbitrary division. But stable disease or progressive disease, they count as non-responsive. And the patient has already received neoadjuvant chemotherapy, so there's no way we are going to resort to any other therapy. Why not radiation rather than surgery in this case?
So there is a lot of slough tissue one, and also it won't. Our margins won't change, and it will lead to a lot of necrosis.
Necrosis of what?
Mandible.
Because the mandible is involved, so osteoradial necrosis is likely to happen. So that is what? Muskan, is that clear? Yes. So osteoradial necrosis being a factor. So a tumor or a disease which is attached or involving the mandible, we'll try to avoid radiation upfront. And thirdly, the dose of radiation that you're going to require as a primary therapy is going to be very high, very toxic. What is the toxicity of radiation in the head and neck?
Mucositis and
Sicca syndrome.
Sicca syndrome.
Everything dries up. So mucositis, etc., and drying up of the secretions, yes, that all will be. You know, it's quite a high morbidity. Don't underestimate it. And osteoradial necrosis will lead to pathological fractures, etc. So it's a risky thing.